Hello, I'm Dr. Abhipsa Mazumdar, Consultant Obstetrics and Gynaecology, Manipal, Broadway and Salt Lake. Today we will be discussing about a very important tumor of the uterus, that is fibroid. Usually we are very scared when we hear the word tumor. But today we are here to burst the myths about fibroid and discuss the treatment options. Fibroid is basically a benign tumor of the uterus. Benign means non-cancerous. What are the most common problems that can arise from a fibroid uterus? First is the patient may complain of increased bleeding during menses. The increased bleeding can be either in increased amount or it can be for more number of days. Second can be increased pain abdomen. If the patient is having very much pain during menses or which is lasting even after the menses, then there is a need for doing an ultrasonography for diagnosis of fibroid uterus. Along with this, the patient may feel heaviness in the lower abdomen because it is a tumor, so it is heavy, so it can cause heaviness in the lower abdomen, and along with that the patient may also have difficulty in passing urine and stool sometimes. What are the myths? Usually we think that tumor means cancer, but let me be very clear. Fibroid can turn into cancer in very rare cases. So less than 0.2% of the fibroids actually become cancerous. So you can understand that the risk of becoming cancer is very less. What are the treatment options that we have for fibroid uterus? Basically, it depends on the age of the patient and the size of the fibroid. If the age of the patient is less than 40 or 45 and the patient expects to have another child, so we usually plan for those kind of treatment which can save the uterus. Next is, if the size of the fibroid is less than 5 centimeters, we usually opt for some medical treatment, that is with medicines like tablets or injections. We try to shrink the size of the fibroid. If the size is big and the patient wants a removal, then also we have two kinds of surgeries. One is removing just the tumor and leaving behind the uterus, which in medical terms is called as myomectomy. Or if the fibroid is very big and we cannot leave behind the uterus, then we go for a hysterectomy or removal of the entire uterus. Now, doing this both myomectomy and hysterectomy can be done by open technique, by cutting open the abdomen, or in recent advances we usually do it by laparoscopy, which is helping the patient to go back home early, less pain, less size of the scar, and easy return to her normal activities. So the next time you are diagnosed with a fibroid uterus, do not worry, do not be tense, just talk to your gynecologist. Thank you.